Just as quickly as masks have come off, health experts are now recommending we put them back on.
It's pretty clear that there's more COVID now than there was a week ago and 2 weeks ago. And we're at the very early parts of a wave.
Cases of the Omicron subvariant BA2, sometimes referred to as stealth Omicron, are rising nationally. In Nova Scotia and New Brunswick, there's more healthcare workers becoming infected. Wastewater data from Ontario and Alberta has shown an increase in the virus. And over the weekend, COVID hospitalizations started to rise in BC. And that's not the only province.
When you see an increase in the community cases as an indirect measure, you have to be concerned that there will be an increase in hospitalizations. And in fact, at least in Quebec, we are starting to see an increase in the hospitalizations.
Stealth Omicron has been blamed for a tsunami of COVID cases in China, the UK, Germany, and France. But only the latter has recently experienced record hospitalization rates. Another concern is BA2's ability to break through vaccination and reinfect those who've already had COVID. Dr. Alison McGeer says the timing of this wave for older Canadians who are now 4 to 5 months out from their booster is concerning.
Their protection from severe disease will have dropped from somewhere in the 90s, right after their third dose, down to somewhere maybe just below 80%. And while that doesn't sound like a big drop, it's actually a doubling, right?
The US FDA has approved fourth doses for all Americans over 50. In Canada, it's residents of long-term care and immunocompromised adults who are currently eligible.
It's not the answer, but it's part of this multi-layered approach to trying to control cases and obviously control severe illness and death.
An approach we are all too familiar with 2 years in. But it's whether we decide to react with personal protective measures or choose to ignore the warnings, experts say, that will determine the impact of this spring surge. Jamie Marucker, Global News, Toronto.